Assalamu alaikum. Today we are going to talk about how to make a surgical guide yourself on doing any implants at all. So here we have a case in which these teeth are missing, and if you see, what I did was I took the impression, poured the cast, and on top of it added some wax, which is just a basic set of wax, and then the teeth were placed, denture teeth are placed on it. It covers Sweet and Wilson properly. That way we have the proper widths of the teeth also. And then you take an impression. You soak this into water, and then you take an alginate impression. Once you have taken the alginate impression, you get a cast like this with the teeth in the cast. And then what you're going to do is on top of it, make a suck down acrylic splint. Make sure you use hard acrylic, not soft, and about 1 to 1.5 millimeter thickness. Once you have done so, you come back to this cast, and now you remove the teeth with the wax, and you'll put the splint up on top, and in the center of each tooth you drill a hole. This acrylic on the bottom is not there at that time. The splint is totally empty and clear. So you drill a hole right down the middle of each tooth that you're going to replace. That way you know that the angle of the tooth is going to be right, and the implant screw or the implant center is going to be in the center of occlusion of each tooth. And then through that hole we also found where the ridge was, and we drilled a hole into the ridge, each ridge. And then what you do is you take these sleeves, metal sleeves, and these are screws that are available through your implants, or you can buy through a hardware store, and you pop them inside, and you make sure the screw is coming out of that hole right there. And then all you gotta do is put the acrylic split up on top and fill the inside with acrylic. And once you have done so, then the splint itself looks like that. It has a sleeve inside and the screw is removed, and through the splint, now wherever you're placing the implant, you pop this inside the mouth and you seat it down, and then you drill through that. And when you're drilling through that, what you're doing is inside the mouth, once you have laid the flap, as you take the drill through, let's assume this is a drill, as you take it through, the angle should be very visible to you. And if this is a drill, you should be able to see exactly where you're drilling into the ridge itself. Okay, and we have some pictures to accompany, and that will show you exactly how these holes are drilled. Once these are drilled, all you gotta do is remove the splint, just like that, and you have the pilot holes inside. And you follow the angulation to make sure that the implant goes into the bone, into the ridge, and on top it is coming out the center of the occlusion of the teeth that is guided by the splint itself. And that way the chance of errors of convergence and divergence, as well as where the occlusion center is going to be, is solved for you.